Hi, welcome to continuing the conversation with Sadie, where we explore care through the lens of dignity, emotional literacy, and systemic innovation. Today, I am truly honoured to be joined by Professor Vic Rayner, OBE, Chief Executive Officer of the National Care Forum. Since taking the helm in 2016, Vic has been a leading voice for not-for-profit care, championing quality, innovation, and the centrality of dignity in service. Her leadership extends far beyond the forum. Vic chairs the National Social Care Advisory Group on social care and technology, guiding the sector through digital transformation. She has served as chair of the government's National Workforce Advisory Group, sits on the House of Commons Health and Social Care Committee's expert panel, and has contributed to the all-party parliamentary group on adult social care. Vic's influence is felt nationally and internationally. She is a regular speaker on care, housing, and social policy, bringing clarity and courage to conversations that often feel weighed down by bureaucracy. Her advocacy reminds us that care is not just about compliance, it's about relationships, emotional safety, and the collective responsibility to protect dignity. In this episode, we'll explore her leadership journey, her advocacy for quality, the distinct role of not-for-profit care, and her vision for the future of care. Vic, it's a privilege to welcome you to the podcast. Thank you.
Thanks very much, Sadie.
Yeah.
Very kind.
Vic, I'd love to begin by exploring the foundations and values that shape your leadership in care. My first question today is what first inspired you to step into leadership within the care sector?
So I think there's probably a lot of different things that have kind of led to where I am now. As with all good stories, they start with your mother, don't they? So my mum was an OT, and
What a
so
job.
my childhood memories are she worked in a large psychiatric hospital,
Mhm.
them or many of them being closed down. So as a child, I used to go with her sometimes to work, and so I understood a little bit about her work and what she was trying to achieve, but also a sense of quite how challenging it was for people to thrive in that environment. And then I think I was very interested in the whole community care
Yeah,
act, and because I'd been in those settings, I suppose understanding just what a difference that made to
yes,
people in terms of their then having a much more independent life. And I think
yeah,
we continue not to
100%.
learn that
Yeah,
in it with all of the transforming care sort of work that goes on. So I think that was some of the early stuff. And then I mean, ultimately, I've always worked in the charitable sector in some sort of shape or
hmm,
form. So I've worked in volunteering in lots of organisations. So I've always been a volunteer trustee, and I'd really encourage people to do that if they don't do that, because it centres you in your community and also
100%.
areas of interest that you've had. So I've
Yeah.
been part of the Workers' Education Association, WEA, Citizens Advice Bureau, as a trustee, Hestia, which is a large London-based support provider,
Mm,
care workers charity, I've been a trustee of. So all sorts of different things. So I think that's part so that gives you a sort of sense of the breadth of the sector and also understanding the broader
yeah,
community offer for people.
the
And then
the
I've
impact.
worked in various different, I've worked in victim support, and I've worked in the National Citizens Advice Bureau, and
Wow.
then I spent a long time in the supported housing sector, so working
Yeah,
there with all sorts of different types of support model. I worked with the women's refuge as well, so I've done lots of different kind of things that help
yeah,
me understand. I mean, all of them driven, I think, by a social justice kind of agenda
yeah,
for me, that actually
absolutely.
there's lots that we can do that will enable people to live the lives that they want, and I personally feel we all have a responsibility as citizens to do as much as we can to enable that to happen.
Yeah, I love that approach that you take there, especially when I can see you look at the whole picture. You don't get too stuck in the details, which keeps you going forward. I
Yeah,
love that.
yeah.
How have your personal values guided the way you lead and advocate for change?
I mean, I hope I come to a kind of leadership role largely with a sense of optimism. I mean,
Mm,
I think that
Yeah,
There
100% we
people
do.
are extraordinary. I mean, that's part of the story, isn't it? Whether it's the people that you're seeing every day that you're providing care for, whether it's their families, whether it's the organizations who deliver it, generally, people can achieve incredible things.
Yeah.
And so I think often it's the barriers we put in the way of people that stop that. So I suppose my leadership style, I hope, is one based on a strong sense of collaboration, a strong sense of enablement in terms of trying to give people an opportunity to
Mm,
do as much as they feel comfortable to do.
yeah,
So I think, yes, so I suppose, yeah, we put barriers in people's ways. So I think what I try to do is to explore with people what's of interest to them. I suppose I think what I was about to say is I have generally found that a bit easier to do in smaller organizations, and I think
yeah,
that's an interesting thing for us
yeah.
to reflect on that,
That's a really
um,
interesting point, actually.
and especially the kind of organization I've generally worked in, which is
Mm,
trying to, has to be very flexible and responsive and change direction quite quickly, and I just
very, very good
for
point.
me personally, I'm interested in everything, and that's a blessing and a curse in a
Yeah.
sense, because I want to know what the thing that we talked about last week. I want to know what's happened with it. I definitely want to work in a collaborative way, and I think we do that within our own organisation, but also try to do that
Yeah,
with partners across the sector. I
yeah,
think you have to have values. You have to have something more than a job description, and I think that's
correct.
what you find in the care sector is it's full of people who want to do more and
Yeah,
want
very
to
passionate
things to be
people.
better, and that's what a difference that makes to why you want to work. Why
Yeah,
why you get up in the morning, why you get on
yeah,
with it, really. And I think that's the difficulty for the care sector because, you know, that means that it's a difficulty, generally in the sense that, actually we've got 1.6 million people working in the care sector, and large numbers of them are doing more than they are sort of technically described to do
yeah,
because they love it and they believe in it and it's important. But that
yeah.
shouldn't be the
That's a
way that we
whole new
work, and that's
subject.
and
Yeah,
it's definitely a whole. But if you're thinking about leadership and kind of your very strong interest in kind of the emotional leadership thing, I think
yeah.
that people do that because they want to, but of course they have other lives, so we can't rely on that.
I think that the emotional side is about understanding people's situations and lives and what they give to the care sector, but it's also looking at systems and the way we do things and how that
Yeah.
needs to change. And I work with that on a very small scale, but in a very innovative way, which is growing, but it's new. And then I can see through this podcast guest I spoke to a couple of weeks ago, how his influence on the social care sector is affecting that as well. And that they're coming up with new ideas and it's all being shared online. And that's helping managers come up with new ways to manage problems, which is all very positive. And it's exactly what you're talking about. It's about that broader picture and finding new ways of doing things. Yeah.
I worked in the housing sector for a long time, supported housing sector, wellness, health,
Yeah.
but actually that's really important for workers as well. And I'm very interested in the whole digital transformation side of things, and I think there are real opportunities and advantages that will support the emotional well-being of staff
Yeah.
as much as they do, or potentially sometimes more than they might do those who draw on care and support. So members who are using things like circadian rhythm lighting, for example, which is support has been brought in to minimize the sort of people frame it as sundowning, the kind of challenging times in the day for people with
Yes.
dementia, for example.
Yes. Yes.
Right. So I
Very
think
true.
that there are things that are coming on the horizon that could really play to the strengths of the sector in thinking
Yeah.
much more about that. We've got to do a lot more in that space to protect people and support people.
Very, very good point again. I mean, how lucky am I to be sitting here learning this and talking to you right now? So, so lucky. And I'm just so excited. It's just amazing. Just great to just get all this perspective from so many different people. What does emotionally literate leadership look like to you in practice, Vic?
So I think, I mean, absolutely, as we've talked about, sort of understanding that people have, there's more to people than the job that they do.
Yeah.
So, and having ways to enable people to have those conversations with you. I mean, yours used to be the kind of open door policy. Now we're not, now we have no doors, and it's like,
Yeah.
how do, which I think it actually creates a sort of different way to have to do that. So
Yeah.
it's almost like, you're not going to pick up things incidentally. It's a very weird set of relationships that if we're not careful, we end up creating. And people do some of this with more success than others. So I have a colleague who every day tries to have a kind, literal sort of cup of tea type huddle sort of thing where there isn't an agenda. There is just, but there's a regular touch in sort of point. So there's that kind,
Yeah.
those sort of ways that can overcome those barriers. I think in the care sector, particularly in the sort of world you're in, Sadie,
Yeah.
the home care, it's really isolating and
Oh,
lonely. So
yes.
you've got to work really hard at both understanding the person who's delivering that work,
Yeah.
and that involves some investment and time from
Mhm.
everybody concerned. I think you have to really be attuned to the impact, and that will help you understand. So, if you're working with somebody who's at end of life and you yourself have suffered a recent bereavement,
Yeah.
the kind of connectivity, it's impossible. Humans can't segment and say this is work, that's home life. It's just not possible to do that. So you have to
Mm.
think about those kind of read across areas. But in order to do that, you have to know more about the person and be connected to them and the things that are important to them. And that, I think, helps you then as well as a leader, if you can kind of enable people to create, to work with people. There's many opportunities again in technology about trying to think about how you match up people with people they're interested with. So
Mm.
if you can, as a home care worker, go and work with somebody who's got the same passions and interests as you have, or some shared history
Yeah.
or some shared connection, then that's more fulfilling for everybody concerned.
Yeah.
So I think
I
how
think this
we
is
protect people and how we
yeah.
encourage people to stay in the sector is all geared around some better levels of emotional literacy.
Thinking about all the things I do and why it's working well because it encompasses everything you've just said. And for
Mm.
me, the only thing I would add is when you talk about connection, my mind goes straight to community.
Yes.
So I don't know if you've seen on LinkedIn, but I advertise my what's called my kindness corners, which is voluntary. And I set up little 1 hour a week in a cafe in people's local area for have a coffee and a chat and to feel safe. And the cafe support me and they get a discount and got Home Instead supporting me now, and that's all about reducing loneliness and isolation. And actually, you talk about the right people coming in using technology, but I just find it organically happens. Like people turn up because they want to be there, and if they don't, they don't.
Yes.
And so these little groups are growing all over my local area. And
Mm.
my viewpoint on this is that if I can do it in 2 or 3 villages alongside my full-time job and encourage other private professional carers to do it, if everybody did that on their doorstep, that would be a massive leap forward to reduce loneliness and isolation. And actually, the cafes get business out of it, the community gets business out of it. It's a win-win for everyone. So
And is
that's
that workers who are coming to those kindness corners, or is
so
that
it's mainly aimed at the elderly, but I do say if you're a carer, bring your client along because it's an opportunity for them to get, business potentially, but also it's an opportunity for their client to meet other people in the area, which is more of the agenda because it's about patient-centered care. So it's just a win-win and it's just working so well. I started in June and we now get 15 to 18 people turn up.
nice? Yeah, yeah.
But it's just I can't do any more. So
No,
I
you
sort
reach a
of
kind of ceiling, don't you? But I think, I
yeah,
mean, definitely connection and community, community is a big part of what we do. You asked at the beginning about sort of not-for-profit care. So I think that
yeah,
sort of side, I mean, that, as I said, that's always been where I have worked. It's always been where I put my kind of energy. And I think what's the advantage of not-for-profit? Well, I mean, I think part of it is that generally they have come from that community itself. So either it's been a charitable organisation that's been set up and established sometimes hundreds of years ago, and it's changed and shifted as the
mhm,
needs of the community have changed. So, sometimes they've offered community transport, other times they've offered nursery provision, other times they've offered
Yeah.
lunch clubs, they've changed and moved as the community has
Yeah.
moved. Or it's a housing association who, have got local stock in the area, so they've got an investment in that locality and they've got
Yeah.
tenants who are part of it, or it's a
It's all
community-run
part of it.
service, or it's a learning disability, and I think often they are, or it's faith-based. I mean, that we've got a lot of members who've got a very strong faith-based approach, and of course, then you've got that broader faith-based community who can engage and be part of it. So, I mean, I think what you're doing sounds fabulous, and actually, people often sort of say, how have we ended up in this place where there's so much loneliness and isolation, and what
Yeah.
did we do? Why was it
I
better
think we
before? Well,
just got
we did invest in keeping people connected together. We had lunch
yeah.
clubs, we had Meals on Wheels, we
Yeah,
had
we
day
did.
services, we had befriending services whose
We
job was
still do.
really, to kind of,
Yeah.
but nobody wants. So I just think that, and we had community centres.
Yeah.
So actually, a lot of when I hear government policy being described, so I was just listening to something about neighbourhood health centres recently. I mean, in essence, we're trying. I mean, I'm delighted at one level. We're trying to recreate some of those hubs that will make it possible. And with the demography that we've got and the change in the older population, I mean, I work.
This is what I
Part of
was
my
gonna
role is
say.
is I chair something called the Global Aging Network, and when if we look at Singapore or Japan or Korea, where the population in Korea by 2050,
Mhm.
people over 65 will make up 40% of the population. In the UK, we're looking at that being about 25% of the population, and we are in no way prepared for that, never mind 40%. So the answer is to
Totally.
actually embed your kindness
This is
corners,
where I'm
in a
coming
sense,
from.
to say,
Yeah.
"Look," and actually, I think we've got masses of kind of assets, to use the term, care homes, retirement villages. All of these things are spaces you could get people to. Local cafes, great, but, actually, if you've got mobility challenges and
Yeah.
everything else,
Yes.
and you can't get there, there are places we could do that, but we will
Yeah.
have to, because that's what Singapore and others have done. Is, you need to have one place where people can come, they can get their healthcare needs met, they can get some decent food, they can get some exercise, they can get their human connection needs nurtured, and they can continue to live independently if that's what they choose to do or are able to do.
Exactly. I mean, we're a population that's living longer
Yeah,
and we're getting bigger, and
which
that's
is
where I'm
great.
coming from.
Let's go. Let's celebrate that. But what you don't want to do is what the chief medical officer is kind of basically describing in his reports, where he's saying, yes, people are living longer, but they're living longer with multiple comorbidities
Yeah.
where they have not got a great quality of life.
Yeah.
So actually, let's make
Yeah.
sure their quality of life gets better.
But we can only do that if we do exactly what you've just said so brilliantly, and that is think ahead. We've got to stop treating the problem after it's happened. This is why
Yes.
so many systems are collapsing. So if you look at things with emotional intelligence like we are today, and using your experience to get some brilliant insight and information about things, you can see that if everybody did their little thing on their doorstep, whether that's a kindness corner or a welcome cafe, whatever you want to do, get creative with it. Creative care is the way forward, as far as I'm concerned, when it comes to doing what you can with what you've got. Because we don't all start with everything at our hands, at our fingertips. We're going to go a long way and we're going to be more prepared than if we just sit around waiting for someone to do it for us. And that's just my personal
Yeah.
opinion
Yeah.
on my
Yeah.
experience of the care
Yeah.
sector. And I love the way you also say we've all got a responsibility, because
Yeah.
I think people forget that. They
Yeah.
sometimes think it's somebody else's responsibility.
Well,
And
and
and I think
people are afraid. I mean, I think that's the other bit, isn't it? We
mm,
work in probably the most regulated sector
yes,
in, certainly in this country, possibly, even more globally than that, in a way.
yeah. And it makes it
There's
very
masses of
difficult.
regulation, and I think people think, well, well, that's because anything I do isn't safe. But of course, the things that you're talking about, the connections, the sort of helping people to navigate,
Yeah,
that sitting in a cafe with you, talking to somebody else who says, "Well, I just ring up whatever, or the library delivers to me, or whatever it might be the Or I have a Silver Line volunteer ring me every week,
Yeah,
and you could have that too,
they
or
learn about yes,
learn
they
about all
share
that
ideas.
stuff. And
Correct.
I think, or actually my daughter-in-law always makes me lasagna for two, and I can only eat one bit of it. Why don't you come? I mean, that I think those kind of ideas, I loved it. There was something called, I can't remember what it was, whether it was what day of the week it was, like a Friday lunch club or something like that,
Yeah,
which is the people were being encouraged, and again, technology played a bit of a part in this, to say, you've got a spare meal. Let me tell you the 10 people in the neighborhood who are,
let's be resourceful.
within
Yeah,
100 yards of your doorstep, who you could go and deliver that to.
exactly, and this is
The
what
brilliant stuff, the circles of care stuff is extraordinary.
mm,
And it gives people a little bit of structure around doing exactly what you're doing. So it sort of says who's in your circle and what could they do for you? And they
yeah,
probably really do want to know that you want to put the washing out, but you've got flu and you can't get up off the seat to do it in the way that you normally would, and they can come and help do that. I don't know why we haven't all got a circle. I mean, we have all got a circle of care at some level, but we're really bad at asking for help even when we're not receiving care and support. And of course, the less good we are at doing that, the harder it makes it, and the more it makes people feel that they're dependent and asking people things for all the time. If we were all better at asking and giving a little bit more each and every day, then we wouldn't create so many of those barriers.
but that's the beauty of creating a safe space for people to
Yes,
talk because it takes
yes,
time to trust. You don't I wouldn't if somebody trusted someone straight away, I'd be like, "Hang on a minute, ask a few more questions," because again, that's
yeah,
part of emotional intelligence.
yeah.
So it's all part of it, and like you said, everything you've just said, it just wraps everything up. I just think is brilliant. We're gonna go on to the heart of your advocacy, quality care, which I can see just massive and something you play a big part in, and the role emotional intelligence plays in shaping it. Why do you believe advocacy for quality care is so vital in today's care landscape?
Because I mean, you may remember that. Do you remember the Andrea Sutcliffe kind of, when Andrea was the chief inspector of the CQC, her sort of mantra was the mum test. And I think that worked for people, resonated with people to some level because
Yeah,
it was personal and close to people. And
yeah,
I think the advocacy for quality, in a sense, is an advocacy. When I see the best leaders in our membership, they very much have that kind of mantra of, and used very effectively in their sort of staff training and other areas. What you walk by is what you're
mm,
prepared to accept. And I think that has to be our kind of watchword in care, because you might not be able to fix it, but you can't
yeah,
walk past it.
yeah,
You can't let it lie and not engage. And I suppose that's why um I I think you have to approach everything through that kind of quality
yeah,
lens. But I also think that quality is quite personal as well. So actually, if people, and I think we've done better with this in some times in the support world, which is where we perhaps are a little clearer about people's own ability to determine what quality means to them.
yeah,
And often that comes with age as well, sort of working
yes,
age, capacity, engagement.
yeah,
But actually, we're not. I think in care, we're much more nervous about people self-determining how they're happy to live, what they want to live with, what feels safe for them. And that's really difficult, because that means you're having, discussions which perhaps feel like they're limiting people's choice. So
absolutely.
I think understanding what quality looks like, but also recognizing it's not, it is far from a tick list. It's something that's going to change and be organic and have to
Mhm.
develop with the individual. But I think if we don't advocate for quality, us inside the sector, then nobody else is going to. We
Yeah,
know that the public has very
very,
little
very good point.
engagement. We
Yeah,
know that there's a really sort of dominant narrative coming forward that, lots of local authority money goes on to care, but very few people benefit from it. Well, all the alarm bells ring in my head when I hear that kind of narrative kind of bubbling up, because that sounds like 3% of people benefit from 78% of the spend. So if we only spent 70% of the spend, maybe we'd have a little bit more for the rest of the population. And that all of that is, that's a risk to squeeze quality out because it's a
Yeah.
smaller number of people who are gonna be impacted. So we've got to be the people who don't walk by. And that's really hard if you're a
Yes.
worker, because sometimes I feel people don't, sometimes can feel they don't have huge amounts of agency, but their voice is really important. And you're doing a great thing here because you're giving people a chance to kind of elevate that voice directly from the front line. And you'll know what quality is. You would be able to tell immediately.
Yes. And again, emotional intelligence helps me because I'm self-employed. I can navigate families through very complicated situations. And the way I manage it from the minute I meet them to the end of the contract is all about that navigation. And that's a massive part of the quality of care, because if that's right, everything goes right, because everybody works together as a team. And you just can't teach it in universities. It's life experience, it's people, it's what you see along the way that is the
So
biggest life
I
lesson.
suppose I think I would challenge some of that, about that, like, you can't teach it in because I think if we can't teach some of that in academia, I mean, I don't think what we've got does a very good job of that. Some of it, and it could be a lot better around those areas, but there are some things. So if we can't, we can teach people to be counsellors and we can teach them to be
Yeah,
psychotherapists. So we
yeah,
can teach people emotional intelligence, but it takes time and we have to invest in it. And
yes.
we're not great in the care sector around reflective practice, for example. We don't give people
This
time
is
to do
yeah,
that. We don't,
yeah.
so I think we need to think about why we end up, because we often end up in the space which sort of says, we'll recruit for values, we'll recruit for
I think
things that can't be taught. I don't know that you can teach people values, but you can certainly create an educational program that will attract people with the values that you want, because it will attract them, because they will want to say, if I'd go on that educational program, I'll be able to use my values and make a bigger impact with my values than I can just by. I think sometimes because we're not necessarily happy with the level of education or the impact of the education, that we kind of reject it as a model. And I don't, and I know, from lots of different conversations, that there is a fear about people being trained to a level that they can't then adapt and flex and work with somebody as they want. And I don't think that's the case, but I think what we haven't got is a model of
yeah.
learning and development. And I saw some brilliant stuff in Canada where they had something called
Mm,
a living classroom, where all of the kind of level 3 equivalent training happened in a care home. The classroom was
yeah.
there,
Thank
and
you.
what they did is that they had people who draw on care and support, who were living within the care home, were mentors for the students.
Mm,
If they were doing something on lifting and handling, as long as they did it safely, they could do that they could hear from the person who was going to be lifted about what the feeling was for them, and then they did it in a better, more respectful, more tight,
yeah.
and I think at the end of that, this was a health and care qualification. At the end of that,
Mm,
everybody wanted to work in care because they could see the impact that their
yeah.
work was going to have on people. So they had the right values. They might not have come into it necessarily, but at the end of it,
Yeah.
the value that was most important was that they could improve people's lives. And that's
Yeah.
ultimately the cohort of people we want in the sector. So I think you can train it, but we've not set it up right yet. But that doesn't, I don't want to put it out the window, because actually we've got to
What I
develop
should
the kind of professional
yeah.
skills.
I think you're absolutely right. And what I should have said in a much better way is that I believe it's a vocation. What I do is a way of life.
Yes.
It's not, I should have said, I don't think you can sit at a desk and learn the job, which is what you've just explained. You
Yes.
can learn it, but you're in the
A living
environment.
environment. Yeah,
Yeah.
yeah.
I
But
come
there
from sort of
are
that point of
things
view.
that. Yeah, okay. But yes, of course.
Yeah.
But
I
I
didn't
I just
explain.
think it's more. No, 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 but I do think that there is a kind of general sort of, not general, but there is a perception that feeds the narrative that this is not a
Mm,
kind of qualified professional workforce. And
yes,
and
100%.
actually,
And that's what I'm
work that you do
advocating. We are
is very
professionals.
qualified, is very
Yeah,
professional.
100%.
But what we haven't yet created is in essence the sort of professional qualification that would develop you, clones of you.
I
the
mean,
Sadie
personally,
army.
from my experience, I loved MVQs.
Yes.
But
Yes,
I
okay,
mean,
because that had that
because
very
I
strong
learnt
vocational.
on the job
Yeah,
and they watched what I did, they corrected what I did, and then for me, that was a brilliant base. I'm not There's lots of care qualifications out there. I'm not gonna say one's good or bad because it's what suits the agency or care company at that time. In-house training is brilliant. I'd rather in-house than outsource because it's within the care company policy. But I have also witnessed it throughout my career some very poor training.
yeah, yeah,
And I think that's a shame because you can get the right people coming through the door and then they get put off by that very environment. There's definitely an avenue there where we could, I think if we got, again, if we're looking ahead to the future, I don't know what you think, but I think if we got the inspirational, experienced leaders like yourself to come and lead the way with some of this training, we'd probably invite more of the right people into the industry because they would have the right mindset going into it. And I think it would also promote integrity,
yeah,
which is a lot of what we're talking
yeah,
about as well.
absolutely, yeah, yeah, absolutely, absolutely.
But yeah, no, that
Yeah,
I totally agree with you. It's not about writing anything off. It's about using it in the right way, I
yeah,
think.
and it's a valuable resource, isn't it? You know, we spend
Is yeah.
millions and millions of pounds on training every year
Yeah.
in the sector, and if it's
Yeah.
not delivering the thing that we think it should, or as you say, it's putting off people rather than
Mm.
enthusing them and skilling them,
Yeah.
then w change it. Let's change it. It's not,
Yeah.
we can't
Bri
stick with something just because it's there.
Yes, absolutely. Quality is often measured in compliance and outcomes. How can emotional safety be embedded into these measures?
Great, great question.
When you add in safety, I know it gets a bit, tight and
Well,
ruly, but
yeah, but I think the difficulty is, as I say, we're in a very regulated environment. As with everything, we measure often what we can count. So, that's part of the problem, isn't it? We don't have a particularly robust set of outcomes measures for people. And I think we've got members who've done some brilliant work in that space, but it's not universal. And as with lots of things within the care sector, because it's not kind of medical, we haven't got the frameworks or the resources that pick up that. But even if we did at one level, that wouldn't sort of pick up your kind of emotional safety point. So how do we measure emotional safety? I mean, is this for staff you're thinking about or people?
I think this is more in line with policy and how we sort
Yeah.
of hit the masses with if you say you own a care company, how would you make sure that these needs are met through policy? I mean, I'm self-employed, so I'm connected. I have a community of other self-employed carers. So we share these ideas online. We connect using online tools. So
Yeah. I
we
mean, I
sort of
think
bash it
there's an
out that
awful.
way.
Yes. I mean, there are clearly, from a policy context, there's lots of great organisations out there who provide policy
Mm.
support to organisations if it's like the delivery of policy rather than trying to influence
Yeah.
government policy. But there are also large numbers of informal networks. Skills for Care run regional managers networks. There's lots of those kind of things that are available to people. And I mean, what they all pick up is the very vital kind of peer support side of things. I mean, we run a managers conference every year where we get 200 or 300 managers together. And the big issues that they want to talk about are often in that sort of emotional safety, emotional leadership space. We've had people like
Mhm.
Michael West come and talk a lot, come and talk about the kind of emotional leadership side of things, and
Yeah.
how you protect yourself as a leader, how you kind
Mhm.
of work in that way. But as we talked about, I mean, the other sectors not very far away from us, the health sector and other things use reflective practice, social work use reflective practice much more.
I
Yeah.
think it's
And
essential.
I think we don't. I mean, I would say that as a sector, well, what do they at the sort of top of the sector, if however you see the top, if you look at the sort of chief exec kind of level. I mean, we're not.
Well, you're at the top.
Well, I
You
mean,
are in my
I'm
eyes.
sitting in a. I mean, I sort of sit in a slightly different space. I sit in a membership organisation, policy advocacy. I'm not delivering care. So, but I think the leaders in the space of delivering care, the leadership development opportunities for them are quite dictated. They're quite sort of, they interject. So there's sort of, conferences or events or breakfast meetings there's
Yeah.
not a kind of, and they will have leaders networks, and we run network, but I don't think we sort of, I suspect it's the sort of thing where people say, well, we just don't have time. But, clearly lots of your work and lots of kind of books sitting next to me about human leadership, there's lots
Yeah.
of these sort of
There's some
things would
fantastic
advocate that
books.
actually you have to spend a lot more
Yeah.
time on your own personal development.
Yes.
But, people have got incredibly busy lives generally, and they're
Yeah.
trying to run enormous, sometimes, organizations as well.
Yeah. Very
So
true.
I think we probably need to continue to look at some of those other models, the reflective practice models. If you're a
Yeah.
social worker, you've got requirements around this. If you're nurses, you've got requirements about CPD. We need to think about, when people come into the organization, there's a major commitment around training, and there's mandatory training. But the
Yeah.
further away from that front line you go, the less we talk about development and
Yeah.
self-development and
But this is the
space.
juicy stuff. This is the stuff that keeps people in the industry. So until we
Yes.
address this,
Yeah.
retention is always going to be an issue.
Yeah.
What changes would you like to see in how policymakers and regulators understand and evaluate quality care?
I mean, I would love my ambition is I was listening to a politician say the other day, and I think it might have been Rachel Reeves talking about the budget. I came into politics to make sure that it was about children and poverty, to make sure, I want a politician to say, I came into politics to make
Mm.
sure that people who draw on care and support have a better life. And that will be the moment when that there's been some cut through. And I think we have
Got
not
you.
got that as a concentrated kind
Yes.
of constituency
Hmm.
that matters in the political arena in the way that it should. So even if you got the sort of, even if you've got somebody with an ambition around health, they will talk about, I want to make the NHS a better, we're not getting that kind of cut through that says, and because of that, the public, and they will say it's because the public are not interested. My argument is government
Mm.
can absolutely set a direction which then will require people to be interested.
Yeah,
Why
you
people
are so right.
who self-evidently will age and who self-evidently will need some sort of care and support at some point
Yeah,
are not interested in what that would look like is a bit like saying, quite frankly, parents aren't going to go to school again, so why would they be interested in education? It's a madness. I think that's what we've got to get, and and clearly we want them to come up with, quality to be the kind of cornerstone of that.
yeah,
But just getting them to the point where they are ambitious about it
yeah,
would be a really important win. And we've got a bit of that with this government. I know people are, get we've got a focus on the pay of care workers, whether you agree with the approach or not. We've got to focus on,
I just think
reform.
politicians, yeah, I think politicians need to be more relatable. And if they made that cut through, like you said, they would be. At the moment,
Yeah, I mean, they
they're not.
definitely. Well, let's give them a strap line. I mean, I always, I think, with it, my sort of various different strap lines, NHS saves lives, social care changes lives. You could talk about social care mattering to us all. There's lots and lots of things that are absolutely relatable in a way that I think many of the things that they've ended up centering on as policy ambitions are not on people's
Yeah,
radar.
yeah,
They're
so
they're
true.
reactive. They're reactive. And
Yeah,
this is going to be, we will move into a scenario where we have less people able to work, more people requiring care and support,
yeah,
less taxation coming
it's
in.
happening
You know,
already.
and even if you want to say, well, no, technology will take away other people's jobs, so we have plenty of people to work in the care sector, we won't be able to pay for it
Yeah,
because those people haven't got
correct,
jobs.
correct.
So what are we doing now to proactively invest and engage in
Yeah,
addressing that?
I think we
Some
have to be.
things, but we need to do a lot more. And
Yeah,
your suggestion that we can all do some of that, we can all make that more visible, is absolutely right. 'Cause
No, I
otherwise we're not
just
gonna find a we're
no.
not gonna find a way forward.
Yeah, and people struggle to stay focused. I think they forget that the point is here that we can't be reactive, we have to be proactive. We have to think that we're getting bigger as a population, we're living longer. We have to keep that at the forefront of our heads because then when we do something, it's for the right reasons.
Yeah.
That's how I see it anyway. I think I explained that better than the educational thing,
Yeah.
which was
So
not as
don't worry.
positive.
No, don't worry. I mean, it just gave me a chance to get on a hobby horse. Now I'm too busy talking, so
I was just thinking I'd like us to just pause and reflect on the distinct role of not for profit care models and how they embody values of dignity and emotional safety. So, this question was about what do you see as the defining values of not for profit care and how do they shape practice?
I think the defining values of not-for-profit care are, well, it sort of does what it says on the tin. That everything, all the money that kind of comes into that, whether that's from people paying for their own care or whether that's
Mm,
from state-funded care, it's reinvested back into that organisation, into the staff or the delivery of the care. And I
hmm
think from a perspective of dignity, I mean, I think that that means that the opportunity there, I suppose, is for people to use that reinvestment into ways that enable people to live the lives that they want more
Yeah.
effectively, and for staff to be better resourced and supported to do some of that. So I think
Mhm.
there's a financial bit which I think is a
Yeah.
bit of a no-brainer in a way. Why
Yeah.
wouldn't you want that to be the case, that there's money isn't kind of taken out of the system? But I think probably more is often, there's some important things about governance. So generally not-for-profit organisations, different structures, so have slightly different models, but generally they are run by a group of non-executives or trustees who, depending, either come with an interest, a local interest or a sector interest or a community interest, who have oversight of how the organisation is run and ensuring it's keeping to its principles. If it's a charity, it's regulated, often has further levels of regulation, so it'll have charity regulation attached to it. So it's got some, or if it's a housing organisation, have housing regulation. So there's kind of further endorsements of its regulatory compliance and integrity in that way. So,
Yeah.
there's those sort of things. And then I think it's important to staff. I mean, that's part of the message we get back often from people who maybe go and work in other bits of the sector, is that they like working for a not-for-profit organisation. Not
Yeah.
everybody, it's not important to everybody, but there's a group of people that is important to. And of
Yeah.
course, it also, as I said, it allows for other interests around faith and around various different elements to connect up and be part of it.
Thank you for sharing your leadership journey and the values that guide your work. We've explored the foundations of care leadership, the role of emotional intelligence in advocating for quality, the distinct strengths of not for profit care models, and the resilience we need to shape the future. What stands out is how your leadership at the National Care Forum continues to remind us that care is not simply a service, it is a relationship built on dignity, emotional safety, and collective responsibility. Your advocacy shows that when we embed emotional literacy into systems, we create spaces where both carers and communities can flourish. To our listeners, may this conversation inspire you to reflect on the values that guide your own practice and to continue building care that is relational, resilient, and rooted in dignity. This has been Continuing the Conversation with Sadie. Until next time, take care of yourself, each other, and keep reflecting, keep growing, and keep caring. Thank you very, very much.